Let me take you inside a story that haunts every trauma bay. It starts with a crash, a busted motorcycle, a young guy, Jordan. His femur snapped like a dry twig. But here's the twist. That break? It's not the only threat lurking in his blood. Jordan arrives in the ER, cracking jokes through the pain. I'm relieved. He's stable. Vitals are good. We monitor, keep an eye on that leg, plan surgery for morning. He's even flirting with the nurse. By all appearances, he's out of the woods. But medicine loves a curveball. 18 hours tick by. Then out of nowhere, Jordan starts acting weird. He's confused, slurring his words. His oxygen drops fast. Alarms blare, nurses rush in. I see that rash blooming across his chest and neck, a peppering of red dots. My heart drops. Fat embolism. It's subtle, silent, and in this moment, absolutely deadly. What the textbooks call the classic triad, neurologic changes, respiratory failure, petechia. I'm watching it unfold in real time. Now let me break down what's happening inside Jordan. When the femur snapped, fat globules from his marrow squeezed into his torn blood vessels, hitching a ride through his veins. First stop, the lungs. They clog the tiny vessels, starving the body of oxygen. Some sneak past straight to the brain. That's why he's confused. But it's not just a physical blockage. These fat droplets trigger a storm of inflammation, a chemical blitz that spirals out of control. We intubate. We flood his veins with oxygen, fluids, love, hope, whatever we've got. But this syndrome, you can't suck the fat out. You just support and pray his body survives the onslaught. Hours stretch into days. His sister asks me, he was doing fine. How did it turn like this? And honestly, that's the danger. Fat embolism syndrome hides. Sometimes it waits. And when it strikes, it's a race against time. But this story doesn't end on a ventilator. 2 days later, Jordan wakes up, dazed but alive. Did I miss surgery? He whispers, half a smile, and I can finally breathe. Here's the bottom line for you as a future doc. Fat embolism syndrome shows up in about 3% of long bone fractures. Most patients survive if you catch it early. In trauma, the scariest threats are often the ones you can't see. So always keep your eyes open. And never underestimate the fog in the blood.